Hi everyone, I hope everybody is doing fine. Today we will cover unexplained infertility. This is the diagnosis where nobody wants and it's complicated. Well, approximately about 1 in 5 couples experience unexplained infertility. There are different causes of infertility. About female and male, there are 30%. And a major, which is almost equal percentage, is unexplained, which you have no definite cause. Well, to be given the diagnosis of unexplained infertility can be very unsatisfactory to many couples. Many even feel that it's easier to cope if you have a definite reason. As we are humans, we want to know the reason, and that's sometimes disgusting. There are certain studies which have shown that when in a group, when there was no apparent medical problems, over the period of 7 years, it's a big time, only 36 eventually conceived. In the similar group, after having one child, about 79 eventually conceived for 7 years. So some fertility problems just reflect that as humans, we are so much inefficient in knowing the knowledge of human reproduction. There was another study which was done on unexplained infertility. It has shown that about 2 years duration of time, 50% of the couple conceived for the next 2 years, which suggested that the right thing was to do nothing, which means no treatment was required in one couple. Well, you must be wondering what am I talking. So what exactly defines unexplained infertility? It means that nothing is obviously wrong when I say unexplained. That is, woman is ovulating regularly, her fallopian tubes are normal, and there have been no adhesions. That means sticky gluey things, fibrous tissues, or endometriosis, there is red tissue outside your womb, nothing is there, and the man's sperm is normal and moving. And the intercourse must take place frequently, at least twice a week, particularly around the time of ovulation. And this couple must have been trying to conceive for the previous last 2 years at least. So most of the studies have shown that about 10 to 28% experience unexplained infertility. So when there is nothing is obviously wrong, we must be wondering possible reasons for that. Like anatomical abnormalities, for example, a tilted womb. If you look at this, the womb is usually in front of the bladder. A tilted womb is at the back. Could be a possible cause of infertility, but this one is considered as a myth. It's no longer a case. Abnormal level of hormones called prostaglandin, which are responsible for making muscles contract, may interfere with the passage of egg into the tube, could be the possible reason. Abnormal development of the follicle and the ovulation. That means the egg must be released before, or even it might not be released, forming a cyst. And abnormal eggs, where there is genital abnormality inside the egg, and sometimes problem with the ovulation, embryo formation only. I mean, abnormal embryos being formed once the sperm meets egg. Trapped eggs, that means egg has been trapped and can't enter the tube. And luteal phase abnormalities, where after releasing the egg, the support system which is necessary for the embryo is not enough. And we have nothing to know about it. It's so overwhelming to know when we don't have any cause. There must be a treatment for this problem. And many, you might feel anxious and you want to try different medications, fertility drugs. But you is not, here come back. Rejected for what? In terms of treatment, you may feel anxious to try fertility drugs, but you shouldn't be offered any oral fertility drugs like clomiphene citrate, clomid, femara, letrozole, because it has proven that have not been found to improve the chance of pregnancy. Compare trying for the baby naturally. So if you have been trying to conceive regularly, conceive through regular intercourse for over a total 2 years, which would include 1 year trying before you had fertility tests, and you have not become pregnant, you may be offered an IVF. You'll be surprised, why am I talking about IVF? There are certain studies which have proven the process, what has happened. So in unexplained infertility, a woman couple, when there was no treatment, the approximate cycle fecundability, that means percentage of getting pregnant in one cycle per month, was almost 2 to 10%. They tried no treatment, was still 2 to 10. Tablets like clomiphene citrate oral, still 2 to 4%. Gonadotropins, called injections, about 5 to 7%. And IUI, where intrauterine insemination, where your man's semen is inserted inside your womb, there was slightly increase in percentage, about 5 to 10. But compared to an IVF, that is in vitro fertilization, where we'll collect your eggs by giving you medications, and after collection, these eggs are fertilized in the lab in a petri dish, and after forming embryo, the formed baby, it is inserted inside your womb through a small cannula. So IVF has shown about 25 to 45% of fecundability per cycle, which is proven to be a greater number. So you may be offered an IVF after 2 years of trying naturally. So we have certain guidelines, colonized guidelines. It does say that ovarian stimulation through drugs should not be offered, and because standalone treatment with only having fertility drugs doesn't increase the chance of pregnancy or a live birth, and you have to be trying naturally for about 2 years, and you will be offered an IVF because it has higher approximate cycle fecundability of chance, that is chances of having pregnancy per cycle is much higher. So this is for any couple who have been told about unexplained infertility. I hope everyone have a good day and see you next.